Okay. Good morning, everybody. Thank you for joining us today for the Healthcare Support Worker Recruitment webinar. My name is Samantha Ragg. I'm the Recruitment and Resourcing Manager for LYPFT. And today I'll be taking you through who we are, what we do, what it's like to work for the Trust. Then I'll give you an overview of the services that have vacancies at the moment. Followed up with some tips on how to make a good application and interview. And I'm joined by some colleagues today. I'm joined by my colleague Jo Riley, who's our resourcing officer. Jo is going to be managing the Q&A box for us. So if you have any questions throughout the session, please do pop them in the Q&A function, which you'll be able to see at the top of your screen. Just click on there, type a question. Jo will do her best to reply to you unless she's completely overwhelmed with questions. So if there's any that we don't have the opportunity to answer today, please don't worry. We will come back to you. We'll follow up on email. We will come back to you on your questions. We're also joined by my colleague, Sam Iverson. Sam is our Apprenticeships and Employability Lead for the Trust. And Sam's going to be giving you some advice on support, if you need it for application and interview, and also go through some bits on career development as well. The session today is being recorded, which is why your camera and your mics are not active. And that's simply for your privacy. As I mentioned, the session is being recorded. So again, any questions, do use the Q&A function. But on that, let's begin. Although I will actually just say before I begin, if at any point you feel like you want to leave the session, if you feel that it's not for you, and you don't want to stay for the rest of the session, please don't feel like you have to. The whole point of the webinar today is to give you a bit of an insight into what it's like to be a healthcare support worker within the organisation. So absolutely no pressure if at any point you feel that it's not for you, do feel free to drop off from the call. So let me tell you a little bit about Leeds and York Partnership Foundation Trust. We are the main provider of specialist mental health and learning disability services in Leeds. We also provide specialist services across York, the Yorkshire and Humber region, and we do have some highly specialised national services as well. And we provide services for people experiencing a mental health crisis that requires urgent assessment and treatment. And that might be somebody's first experience of a mental health crisis, or it could be a relapse of an existing mental illness. We also support people living with issues such as addictions, eating disorders, or physical problems with psychological causes, and those needing the support of our gender identity services as well. We are also a values-based employer. So we strive to be an employer of choice, and we do this by putting our staff and the people using our services at the centre of everything that we do. And that starts really with the people that we employ. So we recruit people based on their values and their qualifications where required, but really believe that lived experience is an advantage to being a healthcare support worker in the organisation. So we look for potential in people, not perfection. And this means that together we're as diverse as the community that we care for. So simply put, we seek out people who care, act with integrity, and have the right skills. And we want to add people like yourself to our incredible staff, students and volunteers who share these principles. And we need people like you who have empathy and find that empathy comes really easily, and who treat everybody with respect without thinking. So by recruiting in this way, not only can we give more people the opportunity to help those living with mental health challenges, learning disabilities and neurodiversity, but we can also help more people use their natural strengths to feel purposeful, happy and valued in every aspect of their role at LYPFT. So before I move on to talk about our vacancies and the services that we have vacancies in at the moment, I just want to mention some bits of information around immigration, sponsorship and visas. So we've seen a real increase in applications of individuals who are either have an existing right to work or require sponsorship on appointment. So the Trust only sponsors Band 5 and above registered professionals, such as nurses, medics, and allied health professionals. And it's very important to be aware that the current Home Office rules for sponsorship, so if you don't hold an existing visa or right to work and you need sponsorship to live and work in the UK, the Home Office have recently changed the salary threshold for a skilled worker visa to be £25,000. So unfortunately, the healthcare support worker role, which is a Band 3 post, doesn't meet that salary threshold. If you are also on an existing right to work and you would, when that expires, you would need us to sponsor you, you would also need to be in a post that has an RQF level 6 qualification. And what I mean by that, an RQF level 6 qualification is the same as a degree. And unfortunately, the healthcare support worker role doesn't require that level of qualification to fulfill that post. Therefore, we wouldn't be able to sponsor you in that healthcare support worker role. So if you do join us on an existing right to work, that's fantastic. And we welcome applications, but please be aware that when that expires, we won't be able to sponsor you if you need us to. So I hope that all makes sense. If you do have any questions in regards to immigration, feel free to pop it in the Q&A and I will come back to you at a later date around any personal questions in regards to immigration. So that's the boring bit out of the way. Let's talk about the good things about working at LYPFT. So what are some of the benefits of working for the organisation? So we have a really fair and transparent pay structure. A Band 3 healthcare support worker falls within our agenda, the NHS Agenda for Change pay structure. So it's very fair and transparent, and you will work your way up the pay scale of Band 3 from entry point, which is around 23,000 and something, don't challenge me on it, and just over 25,000 at the top of the pay scale. We have a really generous pension scheme. So the Trust will contribute 20.6 contribution towards your pension schemes. It's one of the best pension schemes in the public sector. And we have a great holiday allowance. So everybody starting within the NHS starts on a minimum of 27 days, and that increases with service. We have really good flexible working hours. If you need it, you can put a flexible working request. We have a real commitment to career progression and continuous professional development. We also have lots of new roles and career pathway development options out there for you, which we will talk about a little bit later on. And one of the best things about working for the NHS is being able to apply for health service discount schemes, such as the Blue Light Card. But one of the things I think I'm most proud of as being a member or a colleague within LYPFT is we have a really strong emphasis on being safe and healthy at work. So your well-being really is our priority to us, and we want to support you to feel safe and well at work and at home. So we really foster a culture of compassion, inclusion and belonging where we support each other along our journey. So what can you expect from us? We undertake regular staff wellbeing assessments. So as part of your annual review, your line manager will have a very compassionate conversation with you about your personal and working environment to really understand what individual support is needed and what we can put in place for you. We have a health and wellbeing hub. So we have a really large range of resources to support your own health and wellbeing, and that's both your physical health and your mental health. We have a Health Assured programme, which is something called an employee assistance programme. You can access 24/7 via an app or via the phone. And there's a whole wealth of first line support if you need it as an employee at LYPFT. And then we're really lucky to have some amazing support networks in the organisation. We have the Rainbow Alliance, the Dawn and the REN groups, So Dawn is our Disability at Work network group, and Ren is our Workforce Race Equality network. And they are made up of existing colleagues and service users and ex-service users. And they're an amazing group of people that really do champion a lot of well-being and culture and safety for all of our colleagues across the organisation. So I'm going to pause there. I'm going to play you a video of what it's like to work at LYPFT, just so you can hear the voice and experiences of some colleagues around the organisation.
Got a lot of opportunities for staff members at every level to complete training, to further develop themselves.
Oh, everything from frontline clinical to support services. So you name it, we've got a position for you. Come and join us.
The department has worked with me and the support of the staff network that gave me the confidence to go and to keep pushing for my career as being the best thing I ever did, and I'm really glad that I've had that opportunity.
We are a trust that really cares about our workforce, and it encourages everybody to do to their maximum potential.
I always wanted to work with young people, that's what I was passionate about, and I've done that throughout my career. So I'm a mental health nurse by background. I then completed a degree in child and adolescent mental health, just finished my masters in management practice. That's to ensure that I've got the right experience, the right skills and the right qualities to provide the best care and the best services for young people and families.
If you're wanting to look and to better yourself and to work within the trust, then there's lots of different avenues and lots of support to kind of go down those and see what you're wanting to achieve.
There's constant emails that go around for additional training if people want to do it, if people have interest in different sectors. It's pretty good, really.
You know, there's going to be times where it's going to be difficult, you're going to be supporting people through particularly difficult times in their life, but actually it's a real honour to be able to do that and to get somebody through that and to support them through that process. It's not easy, you know, it's not going to be, I'm just going to come to work 9 to 5, clock in, clock out. That's not what it's about. It's about wanting to make a difference and really get something out of your role.
But I think what keeps me going is working with great people that are wanting to do the best every single day for the people that we are caring for the young people, for the families. Everybody that's in the service, within the trust, within the organisation is doing the best that they can to provide compassionate care.
I think what I like most about it is that every day isn't the same. You're working with people to help them enjoy their life and do things that they want to do. A gentleman I support, he's been skiing and things like that, so looking at different ways we can adapt things for people, just for everyday life as well, going to the shops or going to the cinema, you know, just supporting people to live their life to the fullest, so it's brilliant.
Relationships that we develop with service users, you know, I can't possibly imagine getting that from any other job. You know, the job satisfaction that you get from being so actively involved in someone's life and helping them to, you know, just live as wonderful life as possible. You know, I don't think there's another job that could ever give you that. Like, it's very rewarding.
I think for me, I wanted to work as part of a trust and an organisation that had a track record of providing good, safe, effective care, which is the case at Leeds and York Partnership Trust. I wanted to work with a team that were caring, compassionate and wanted to do the best for the service users, patients and families that we work with. I think within the trust and the organisation, they give you the opportunity to be able to grow and develop yourself, to grow and develop your skills, your interests, and you can progress and develop within the trust and the organisation.
completely transformed my life and stuff. It's just really nice that they've been there for me.
You were far by 5.
Okay. So let me tell you a little bit about the services. So you've had a snapshot there of some of the services around the organisation, but I'll go into a little bit more detail now about services that currently have vacancies within the organisation. So currently, the services that have vacancies for healthcare support workers at Band 3 within the organisation are our adult acute service. And within the adult acute service, they have vacancies in their crisis assessment unit, their psychiatric intensive care unit, Ward 1, which is one of their female acute wards. And then across West CRIS and East CRIS, we have vacancies as well. And CRIS is our Crisis Resolution Intensive Support Service. And I'll talk a little bit more about those in a minute. We also have vacancies in our inpatients older people service and also within our specialised supported living service. So let me go into a little bit more detail about the areas within our services that have those vacancies. So I'll start with adult acute. So our adult acute inpatient services are mainly focused for people of working age who have been assessed via the crisis assessment services. And they're typically people who are admitted into our inpatient wards at the Beckland Centre and at the Newsom Centre. And they're both in Leeds city centre. And they have really complex and quite acute mental health needs and any associated risks, which can only really be managed in an inpatient environment. And typically people staying on our wards have either come in voluntarily or they might have been detained under the Mental Health Act. The adult acute inpatient service has wards at 2 sites, so at Newsom and at Beckland. Beckland has 2 single-sex male wards and 2 single-sex female wards, and the Newsom Centre has just 1 single-sex male ward. And treatment in these wards is given by a whole range of staff from lots of different health professions with knowledge and skills really to support people in crisis and at risk. And service users also that are part of have their care treated within this service also have access to our healthy living services, such as dietitians, physiotherapists, an amazing team to help people with stopping smoking and access to a gym as well. And there's a whole range of occupational therapies too. So our Crisis Resolution Intensive Support Service, this provides support for people in their homes, and that's for adults aged from 18 all the way up to 65 who are experiencing any sort of mental health crisis. And this outreach service in the community operate 24 hours a day, 7 days a week, 365 days a year. So they are an amazing team that really do go into people's homes to give extra support in time of a crisis, which we try and strive to do as a genuine alternative to somebody having to come into hospital. So they're there to listen and talk to our service users about how they're feeling, and there's various ways in which they help people do this in their own homes. So they provide practical support. So maybe somebody's going through a time in their life where they are having a trigger to a crisis and it's impacting on their illness. They're all, a majority of the team are prescribers, so they can help with prescribing medical help and monitoring medication as well. They can also provide short-term psychological therapies for anxiety management and mindfulness, and really help with a lot of coping strategies as well. And mainly their aim is to try and prevent relapse. So they're helping people manage those early signs of relapse before they have to be admitted into one of our inpatient wards. But they also, just as importantly, provide a lot of support for carers and family members in the home as well. Sorry, my dog. So our crisis assessment unit, also, as I mentioned, has vacancies. So we call it the CAU. We love an acronym in the NHS. So our CAU supports adults experiencing a really acute and complex mental health crisis who may need an additional or an extended period of assessment and treatment, usually up to 72 hours. And again, this service is open 24 hours a day, 7 days a week, 365 days of the year. And the team within the CAU include mental health nurses, occupational therapists, other approved mental health practitioners, social workers, psychiatrists, healthcare support workers, and harm reduction workers specialising in drug and alcohol addiction as well. So our older people services, we have vacancies currently in our inpatient older people service at the moment. And our inpatient services for older people provide the care and support for people with really acute mental health needs, including dementia. The service is delivered out of the Mount, which is just a really short walk from the centre of Leeds. And the Mount is really a completely holistic assessment, treatment and rehabilitation centre. And although they are an older people adult service, their admission is actually not exclusively for the over 65. They do have services as well for anyone younger than 65 that require their services. So if there is anybody that's presenting with early onset of dementia, they also provide services for those individuals as well. And then lastly, our specialised supported living service. They're a huge team and really are one of the backbones of our services that we provide. So specialised supported living currently helps around 90 adults with a really varying degree of learning disabilities, physical disabilities and complex needs to live independently across Leeds. So we have around 250 staff at the moment that is predominantly made up of healthcare support workers. And this team of incredible support workers go into individuals' homes. So we have lots of bungalows spread across the city where our service users live as independently as they can to live really active and healthy lives with the support of our specialised supported living services team. And our dedicated staff provide support directly into their homes, typically work in teams of around 10 to 18, depending on the degree of support required by the individual living within one of our bungalows. And they provide care and support purely based on that individual's person-centred needs. So really, as you have seen from the video, they go on day trips, they take them shopping, they go on holidays. They really are an incredible team that help individuals live as independently as they can. And each team specialises in either supporting people who have additional complex and challenging behaviour or those who have complex physical, learning and sensory needs as well. And I'll play you a really lovely short video now from our specialised supported living service.
My support staff help me to make choices. They just help me choose where I want to go.
My support workers make me feel happy. They're always there for me if all goes wrong.
They help me to plan holiday. I went to France.
Go to Pop World, which is a kind of disco for people with learning disabilities.
A support worker needs to be kind and caring.
So there, that just wrapped up really nicely the vacancies we have on offer at the moment from our specialised supported living service. So now I'd like to move on and just give you some tips for those of you that have enjoyed and interested in what you've heard from the first half of the session. You're thinking, yes, this feels right for me. I'm going to apply for a role. I just wanted to go through some application and interview support for you. So some top tips on making a successful application. As an NHS Trust, we currently use an applicant tracking system called Track. So all of our applications are made online. So I'll talk a little bit later on about how I'm going to supply you with the links to the vacancies. But when you click on those links, it'll automatically take you through to our Attract system. Now, if any reason you can't access a digital or an online application form, please do get in touch with us. I will provide you all with an email at the end of the session, and links to get in touch with the recruitment team will be in there if you need an alternative method of application. You can apply offline, you can apply it in writing on paper and either post it back to us or drop it in to us at St Mary's Hospital in Armley. So you don't have to apply online if you can't access that. We have a whole heap of supporting guides on how to make reasonable adjustment requests if you need them. If you have a physical disability, a learning disability, a mental health disability, or a long-term illness, and you feel that you have a reasonable adjustment need to be made to either the application stage or our interview, there's a really comprehensive guide on our website. We'll also get emailed to you at the end of the session today in who you can contact and how you can make those reasonable adjustment requests if you need them. We use currently a specific type of application form that links to the shortlisting criteria set by managers for their vacancies. So when you've completed all of the mandatory information on the application form around your name, your date of birth, your employment history, all of the sort of standard mandatory information, you'll then be presented with some prompt boxes to ask you how you meet the shortlisting criteria for the role. So we have done this really to reduce as many barriers to employment as possible and really to support you as applicants to make a successful application form. But some top tips on what to provide in those boxes of information: use clear language, give real life examples of experience that you've had over the years as working as a healthcare support worker. Be genuine and display your values as much as possible. So again, our values are caring, simple and integrity, and we will look for evidence of those in your application form. And put in all experiences you've had, whether you've been a volunteer, you have lived experience of either a mental health illness, or you've cared or helped somebody with mental health illnesses or learning disabilities, or anybody that's neurodiverse or physically unwell, please do put that in your application form, because we really look for people that have that lived experience. And then just some top tips. So once you've made your amazingly successful application form and you're shortlisted by one of our managers, if you are invited to interview, I just wanted to run through something called the STAR technique. It's one of the best things you can use in interviews. You may have heard of it before. It's been around for years and years, but the STAR method really is a structured approach to answer interview questions really clearly and really effectively. And it helps you showcase your experience and your skills by telling a story that demonstrates how you've handled specific situations in the past. And using the STAR method helps you stay focused. It makes sure that your answers are concise, they're relevant, and they're really impactful. And it's really helpful to use this method when you're asked questions like, tell me about a time you faced a challenge at work, or describe a situation where you had to work under pressure, or give me an example of a goal you've achieved. The STAR method really helps you break down your answer into a situation, a task, an action, and a result. So let's work through an example of this so you know what I mean. So if the interview panel asks you, can you tell me about a time that you dealt with a difficult patient or service user? You can break your answer down into 4 sections. So the situation is, I was working on a busy ward. I was supporting a patient who'd recently been admitted and was experiencing severe anxiety. They were really reluctant to engage with me and the staff generally. They refused their medication and they'd not eaten for a few days. So my task was to help build trust with the patient, encourage them to engage with their care plan, ensure that their basic needs were being met, while keeping them calm and keeping them in a safe environment. So my action is that I approach the patient with empathy and patience, speaking to them in a quiet and really calm way. And I spent time with them, sitting with them, listening without judgment, and just reassuring them that they were in a safe place. I worked with the rest of the team to adapt the care approach, suggested offering food in a less clinical way, and encouraged small steps, accepting a drink and then moving on to a meal and then to medication. So the result of that was that over the course of the day, the patient began to respond positively. They accepted a drink, later they agreed to take their medication, and by the next day, they were much more open and engaging with staff. And my approach really helped to de-escalate the situation. That's a really great example of the STAR method there. As I mentioned earlier, we are a values-based recruiter, and we build a workforce that really reflects our values and our behaviours. And as I said, we will look for evidence of these in your application form and at interview. So all of our hiring managers and interview panels are trained to ask values-based questions, such as the ones that you can see on the screen. So when you apply, you'll find on our advert a document called A Candidate's Guide to Values-Based Recruitment. And please use that to help you prepare for your application and for your interview as well. So I just wanted to mention as well today a little bit about artificial intelligence in the recruitment process. So we're seeing a really high increase in AI-generated application forms. AI is an amazingly powerful tool, and it really can help in everyday tasks if you've got a digital watch, a smartwatch, sorry, if you have an Alexa in your home, if you have a car and you have a sat nav in your car, these are all AI powered technology. So they're really helpful day to day. And these tools can really also help with admin, any sort of administrative task. Lots of people use it day to day in work, and they really can enhance your application and prepare you for the process. But it's really important that you use AI in the recruitment process appropriately. One of the downsides of AI is that it can generate misleading or false information. So we ask that if you do use AI in your application form, on our application form, we do have a declaration box. So we ask that if you've used it, please do declare it, but it also can be a reasonable adjustment as well. And the reason that we ask you to declare that AI use is really because we want to find out about you and how you align with our values and what we're looking for in our colleagues. And your application or your interview really needs to represent your skills and your personal experiences accurately and authentically. So we do allow the use of AI where it can help you refine and clarify your ideas and your thoughts for application and interviews. If you want to use it to research a bit about LYPFT and what we do. And also it helps you find out information about trends in healthcare or professions that can relate to your personal experiences. And it can definitely help check with spelling, grammar and punctuation as well. But don't allow it to invent your skills or overemphasize your experiences. AI will only ever come up with generic responses. So please try not to copy and paste these into your application. And it's also against trust policy not to use AI in interviews. And if you are, if the interview panel do feel that you are using AI in an interview, they may challenge you on it. So please do be aware of that. Okay, so moving away from AI, I wanted to talk to you a little bit about some additional support. So I'm going to shortly bring my colleague, Sam Ibbison, in onto the call. As I mentioned before, Sam is our apprenticeships and employability lead. But before I bring Sam in, I just wanted to mention that if you feel that you are struggling with completing the application form, there is an amazing organisation called the Leeds Employment Hub. The link is on the slide, but I will make sure it's provided to you at the end of the session as well. You can get in touch with the Leeds Employment Hub and they will help you. They'll sit with you, they'll book a one-to-one session and help you complete your application form. If you have any sensory impairments or any visual or hearing disabilities, there is an organisation in Leeds called BID Leeds. You can go onto their website, you can get in touch with them, and again, they will support you in your application and your interview journey as well, to try and help you be successful at application and interview. And then if you just need some general support, if you've been unemployed for a short while or even a long time, and you're coming back into the workplace and you just need a little bit of confidence building and some general support, the job shops based all around the city, both Leeds and York, and they have employability skills advisors who will spend time with you to help you access employment, help you with your applications, and help prepare you for interview as well. So I'm going to pause there for a little bit. I'm going to bring in my colleague Sam, who's going to go through a little bit about some more additional support and then talk to you about some career development as well. So Sam, over to you.
Thanks, Sam. So hi, I'm Sam, and as Sam Ragg mentioned, my team helps with employment support and kind of removing barriers to employment. So we've got a few more links and websites and areas of support that you can access. Joy's kindly going to drop in some of those links into chat as I talk about it, hopefully. So Sam's already mentioned the Employment Hub, and you may have heard about this webinar through that. There is a newsletter which shares information about vacancies and employment support that comes out every week. But you also may be on this call and have some additional support needs. So there is extra support out there if you are neurodivergent, if you have some learning challenges, if you have a physical health condition. So one of the charities that can work with you if you don't feel able to kind of make those requests for reasonable adjustments, don't feel able to advocate for yourself, is Advonet. So they actually supply volunteer advocates who can speak on your behalf and also support you in speaking up for yourself and making sure that you have what you need at interview, during the application process, and also when you come into the workplace as well. So they're a really good connection to have if you do have a kind of learning disability or neurodiversity. We also have a charity called Octavia. So these specialise in supporting people to access work who have lived experience of mental health conditions. We know that having complex mental health conditions or having lived experience of a family member or friend having a mental health condition can provide barriers to work. So Octavia Foundation are there to help you with access to employment, volunteering, and also those skills that Sam mentioned, like interview skills, application support. And then the final one that I wanted to mention was access to work. So you may or may not have heard of this, but this is funding that's available to people. So if you have a physical condition, long-term health condition, a mental health condition, or a disability, there is funding available to ensure that you have the tools and support that you need to be successful in the workplace. So there's lots of things out there, and the Employment Hub can also share information about support if you have additional needs as well. Something else I wanted to talk about before I move on to the development opportunities we have is numeracy and literacy. So whether you work with us or not, or whether you feel that it's the right time when you're filling out an application form, there are free maths and English courses available to people in Leeds. If you're aged 19 or over, you can access English and maths courses through Leeds City College. There are also courses specifically for people who English isn't their first language, so English for speakers of other languages. And there's also some basic skills builders for digital skills as well. So if you don't feel confident with those online job searches, online application forms, AI, all of that kind of stuff, which is out there in the world and talked about a lot, there are digital skills that are available through the Leeds Adult Learning Hub as well. So lots of information out there for you. And have you been able to drop those into the chat, Jo? Yeah, brilliant. Thank you very much. And you'll be able to access that information after this session as well. So if we move on to the next slide, because I am also responsible for apprenticeships, I'm going to give a little bit of a plug for that. So what's great and what you heard in those videos is that once you work with us, that's not the end of your journey. We really want to support people to develop and grow and stay with us and provide the best level of care for our service users. So if you are successful in gaining a post with us and become a support worker, we have opportunities to then develop your skills. So through apprenticeships, support workers can develop their skills within their role or to maybe get ready for the next step as a team leader. So The boxes in pink on the slide are kind of professional development apprenticeships that we offer. So we've got team leader, lead adult care worker, which are both level 3, equivalent to an A level, and senior healthcare support worker, which is also at that level as well. So they are things that people can do without applying for a new job. If your manager supports you, you can take on that development opportunity, and we are here to support with that as a team. And then thinking more kind of structured career development and what you might like to do next if you'd like to advance on from being a support worker, we also offer apprenticeships in healthcare professions as well. So within our trust, people have the opportunity to become a mental health or learning disability nurse. The pathway for that is to do a nursing associate foundation degree apprenticeship, which takes about 2 years. Then you have a year of consolidation, really embedding those skills that you've got as a nursing associate. And then we also offer annual opportunities to then kind of top up to become a nurse. And that takes around 18 months to 2 years, depending on your experience as well. If nursing isn't for you, there is other management development, but also we have allied health profession apprenticeships as well. So there's occupational therapy on there. We also have some dietitian and physio opportunities as well, but they're less common in our trust because obviously we're not focused on physical health. But lots of opportunities out there. We're always happy to talk to people, and there are literally hundreds of apprenticeships for people to think about and use to develop in their career. So I think that's everything from me, Sam, if you want to take back the slides.
Thanks, Sam. That's brilliant. And thank you for going through all of that. Really, really helpful. Okay, so to finish off, I just wanted to go through with you all how you can go about applying for all the vacancies that we've discussed today. So because you've attended the webinar today, through doing that, you kindly provided me with your email address. So links will be sent to you all. An email basically will be sent to you all with all the links for healthcare support worker vacancies in specialised supported living, our adult acute services, so all of the different wards and services that I mentioned, and within our older people service as well. Please do use the support guides on our website. If you go onto our trust website, in the careers section, there is the Candidate's Guide to Reasonable Adjustments, Candidate's Guide to Values-Based Recruitment. I will make sure the links are added to the email that I send to you, but they are on there. Please do use them. There's some really helpful videos as well in there on how to make an application form using our track system. It's about a 10-minute long video of myself taking you through step-by-step journey of how to do a track application. The vacancies that you will be sent today, they will be open for 1 week. So you'll have 1 week from today to apply for these vacancies. And then our hiring managers for those services will begin the shortlisting process. And if you successfully meet all their eligibility criteria, they will invite you to interview. And if anybody at any point wants to reach out directly to those services, links for the hiring managers, telephone number, email address are all in the body of the vacancy advert. So if you want to have a chat with the hiring manager, either before you apply or after you apply, please don't hesitate to do it. They really welcome conversations with you before interview. So on that, please don't hesitate to contact the recruitment team if you have any questions or you need any advice at all. The email address is on the screen there, but I'll make sure it's shared with you all as well. Thank you so much for coming today and patiently sitting there and listening to us talk about the trust and our benefits, the services that have vacancies. I really hope you that all of you apply for one of our vacancies. It'd be really amazing to hear about your journey when you're successful. But Sam just popped her hand up, so I'm going to let Sam come back in with some final thoughts.
Okay, not final thoughts, Sam. I was just going to mention that we do have more information to share about older people services that will be shared in the email as well. There's more video content if that's a service you're interested in.
Yes, actually, thank you, Sam. I'll add a link to our YouTube page in the email, because we have a really vast amount of video resources on our YouTube page as well about all our different services and about the organisation. So thank you very much for joining today. I hope that it's given you everything you needed and you found it useful and beneficial. And as I said, any questions, please don't hesitate to reach out to the recruitment team or to Sam's team. We're here to help you with your recruitment journey. But take care, and I will see you all soon, and you are free to leave the webinar. Thank you very much.